3 new medical schools are set to open across Canada in the next 2 years, and that will place students with health care providers at the community level. The goal is to encourage more students to enter family medicine to help address the major shortages in that specialty right across the country. But as Karen Pauls reports today, there are concerns that adding students to the mix will add to the crunch on teaching doctors' time.
This is the site of the new medical school at the University of Prince Edward Island. It's under construction now, but in 2025, 20 new students will start learning here.
Our students will be trained in a kind of inclusive environment with working with nurse practitioners, nurses. We'll have an on-site clinic here that is what's called a medical home, which is an interdisciplinary program that will have patients from the university community, but also the broader community, and students will learn in that environment.
This is just one of the 3 new medical schools being built in Canada in the next few years. The other 2 are at Toronto Metropolitan and Simon Fraser universities. And they're being built on a new model of education, where students will train in the communities where they'll serve after they graduate.
The Brampton area and the P.E.I region are a very diverse and fast-growing region here. Doctors trained at this medical school will be prepared to work with diverse and underserved communities, allowing them to provide healthcare that is culturally respectful because of the nature of the region.
But there's a concern that there aren't even enough doctors to see patients, never mind taking on the extra responsibility of teaching.
My worries start when I try to figure out how do we bring this number of trainees into a system which is frankly, we're just scrambling to keep the lights on every day, right? And we don't have enough doctors to do the clinical work that we need to do. And having been in academia my whole life, I know that when you bring learners in, I don't see as many patients at all.
The hope is that medical students and residents will take the pressure off their supervising physicians because they'll get more hands-on experience earlier in their training.
And we know from a patient care perspective that physicians who are involved in education are both challenged to stay up to date so they can teach, and challenged by their learners, even very junior learners. So the quality of care increases for patients who are seen. If you're teaching, the learners will go see patients and your time comes out in the wash as far as patient care goes. So I don't think it's going to negatively impact the number of patients seen.
The ultimate goal is to retain existing family doctors while training new ones. Karen Pauls, CBC News, Charlottetown.